Hi, welcome to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. In this episode, I'm going to take a break from the prescription series we started to discuss something I think that's a little bit more relevant as people are making decisions as we're down to the last couple of weeks here of the annual election period. Today's currently November 22nd, and we're closing down on December 7th. And there's a lot of people and plans that are terminating, and they're finding they're getting just standalone drug plan cards in the mail. They're getting auto-enrolled by CMS. And those are the folks that are usually on Medicaid and low-income subsidy that's happening to. But they can still obviously change plans. You're not locked into that. But if you do get one of those cards and you didn't enroll, it's a sure sign your plan's getting terminated. So you definitely want to pay attention to it. Got two really important things in, I'll say, upstate/Western New York that's happening. One on the Albany side, and the other's on the Buffalo side of things. Buffalo, there's a lot of changes happening there, like there are in a lot of places. One of the big ones involves Buffalo Medical Group. They're very, very big and pretty highly regarded out there. A lot of people go. And Highmark has been in contract negotiations with them, and a lot of people have been waiting to see what's going to happen. Well, we do have news on what has happened out there. So this was this past Tuesday, apparently, that Highmark had announced that their contract negotiations with the Buffalo Medical Group, they just ended. So Buffalo Medical Group is not going to be a network, and that's going to start July 1st, 2025. And what Highmark states that they have about 3,000 physicians across Western New York that are not part of Buffalo Medical Group that clients can select from in the physicians directory, in their member portal. Now, if you're like me and like pretty much every client I know, you tend not to want to switch your doctor. And especially now, people are finding it very, very difficult to get a good primary care physician. So this is definitely going to affect a lot of people. They're also making people aware that the decision doesn't affect that they're commercial, Highmark's commercial, they're employer-based, or their federal employee program, as well as the Affordable Care Act. Those members who are covered under a separate agreement with both Highmark, Blue Cross Blue Shield, and Buffalo Medical Group, they've really just agreed to continue that. So there's about 6,000 Medicare Advantage members that are going to be impacted by this. So if you're making a decision, you're in Buffalo, and you've had Highmark. I know there's people who've had them for a couple of years, have been pretty happy. However, this is going to impact a lot of people. The other thing in the news is Albany. If you live in that area, you're familiar with who CDPHP is. And that's an insurance company we're starting to see spread across Western New York. And there's a lot that's been in the news with them out there. We've had a number of clients emailing and messaging us from the Albany area. And I'll read to you some information that was shared, and it involves the Medicare wage index. So while negotiations between the hospitals and healthy plans, normal part of the business practices, they claim that their discussions are complicated by the latest fact that CDPHP and its competitors are facing financial hardship due to the Medicare wage index. And this regulation granted hospitals in upstate New York, basically they're calling it a windfall of about $1 billion. And they're claiming, unfortunately, that federal regulators failed to align private Medicare Advantage premiums with the adjustment. And that leaves CDPHP with a significant unfunded mandate that's going to result in nearly $145 million in losses, they're claiming, over the next 2 years. So CDPHP has far and away, they said, the greatest Medicare market in that area, in the region. So the financial implications from their plans, are going to be greatly exacerbated, they're claiming. And they should know that CDPHP, they've increased their current and prior year commercial rates to supplement historically low Medicare rates. So everybody's going to pick up a share of this cost. And they're claiming that AMHS has failed to acknowledge this in their public communications. So when you're looking at this information, with Albany Medical, and they're the ones that are in contract negotiations right now. That's who they're referring to for January 1st of 2025. And we've seen this in other places across upstate/Western New York. so that, they start publicly putting things out there. CDPHP said they stopped paying this new unfunded Medicare wage index mandate in order to protect their benefits and out-of-pocket costs for their members. But CDPHP does continue to pay out hospital partners at the rates agreed prior to this unfunded mandate. This means that care is being covered. They're claiming claims are being paid. And they're, claiming as well, it says Albany Medical Health Systems has made their contract negotiations with CDPHP public, as is the new norm for hospitals to get members upset that they're leaving the network and hoping its members will cause enough of a stink to help with contract talks. In the past, I know, I'll share an example where this kind of backfired. It says no matter the plan or carrier, if a hospital goes out of network, there is a state-mandated 60-day cooling-off period where members can still continue to receive care at their facility. In addition, if members are already in a course of care at the facility, the period is extended for another 30 days beyond that. So people really need to be aware of this. I know that a year ago or so, Well Now Urgent Care was making it very public that Excellus Blue Cross Blue Shield was not going to be a network, and they kept making a public stink about it. And finally, the CEO of Excellus came out and made a pretty strong statement that didn't look real good for Well Now Urgent Care, and said that, they're just not going to negotiate rates with them because they're trying to charge higher than normal rates. And just recently, we found out that Well Now Urgent Care is going to be back in network with Excellus. So they did finally get a contract in place after, they both had a standoff on this one. So they finally settled that. But, if you're in the Buffalo or Albany market, you want to be aware of these two things when you're selecting plans, especially, if you've got doctors that are in Albany Health, you're worried about this. And if your plan does terminate, you got another 30 days that you can select another plan. So don't, I tell people, don't freak out that December 7th is coming. You might have a little extra breathing room in here. And if you're in Buffalo and you've been with the Highmark, I'm sure, hopefully you've heard about this, but that chapter is now closed on that contract negotiation. So Buffalo Medical Group is saying, sayonara. So definitely be aware of it when you're choosing your plans. For 25, you got till December 7th. If you need some help, please reach out to us. We're certainly here to help you, as well as liking, subscribing to this podcast is helpful, and share with anybody you know in those markets. If there is a market that you're being impacted by, please let us know. We'd love to share this information with other Medicare beneficiaries. I think it's very helpful. We've had a lot of people that have gotten a lot of great information from the podcast. So I want to thank you for joining us. We hope you all have a great upcoming Thanksgiving week. We'll probably release another couple prescription podcasts in the upcoming week as we get closer to shutting down the annual election period here for 2025. Take care. Bye-bye.